Hi, hello, and very good evening. Welcome to today's journal club topic. Now, today's topic is on the effect of stomach 36 acupuncture point on brain. So, previously, we know like stomach 36 as a point along the stomach meridian, and its benefits are not just restricted to only stomach and gastric disorders, right? So, this one, it's a very interesting paper which I came across. So, I just wanted to present that. So stomach 36 point, what are the effects on brain? This is a systematic review and a meta-analysis of functional MRI studies. Okay. So I just mentioned the authors and the journals of Frontiers in Neurology with an impact factor of 3.4, one of the frontier journals. Okay. So in the next 30 minutes or so, we are just going to explore not just the effect of stomach 36 on brain, but also its clinical application as well. Okay, so this is the screenshot of the paper. And before going further deep into what this paper actually says, I just want to tell what exactly functional MRI is. So MRI, we generally use it for like if there is any disc bulge or disc prolapse, or is there anything we want to see on the soft tissue injury, we generally use an MRI. So MRI is relatively safer when compared to X-ray, CT, and other things as such. Now, what is a functional MRI? So functional MRI is if you are doing some kind of like say an activity. So it's not just MRI shows only the anatomical structure. Functional MRI is something like it shows the physiology, what is happening in your brain at that point of time. Say, for example, if you're doing some meditation technique or if you're doing some pranayama, at that point, for that specific pranayama or for that specific meditation, which part of your brain is getting activated at when you're doing that particular intervention, right? So that is what functional MRI measures. And how it measures, it is via the changes in the oxygen demand. Whichever organ or whichever part of your brain requires oxygen, that would be shown in your functional MRI. Okay, so whenever you're doing work, obviously there is some oxygen demand, there's some blood supply over that area, right? So the blood is getting supplied to that area just to produce or just to supply the oxygen which is in demand, right? So in these studies, what they are seeing is when you are putting a needle at the stomach 36 acupuncture point, which area of brain or which part of the brain is getting oxygenated, okay, which is getting activated in to put in the simpler words. Okay, so that is what we are going to see in this particular systematic review and meta-analysis. Now, stomach 36, as I was just mentioning, it's not just an acupuncture point for stomach and gastric disorders alone. Now, stomach 36 or the Susan Lee is a commonly used acupoint. In stroke patients, we generally use that. And for pain, sleep disturbance, and also for psychological diseases, we've been using stomach 36. Now, initially, I'm just going through all the background given in this particular paper. Okay, so they've given a brief introduction about what is a functional MRI, and they've given a brief introduction about what stomach 36 is. And then they talk about the animal experiments. So what are the animal experiments done so far on, with the stomach 36 points are, it has shown anti-inflammatory responses. And mostly we use stomach 36 as anti-inflammatory point and also homeostatic point, right? So it has been shown in the animal experiments that it has got anti-inflammatory response and it impacts the vagal adrenal axis. It stimulates somatosensory and motor areas as well, along with its impact on cerebellum and limbic system. Now, the major advantage of doing animal experiments is that we can dissect the animal later and see which part of the body actually got stimulated or got inhibited, whatever it is. But in human models, due to ethical issues, we won't be able to do that. Animal experiments would help give a better clarity and clearer picture on the mechanism of action of of many treatments, and one of this is being used in acupuncture. And in patients and human studies on cerebral infarction or the other stroke patients as such, what they found was stomach 36 improved the brain metabolites and memory function. It promotes motor function. Clinically, when we are dealing with patients with stroke on stroke rehabilitation, we generally use stomach 36 to see improvements in the motor function. Okay, so it also just paves way for neural and cognitive recovery as well. And going ahead with all the background things, so the previous small studies show that acupuncture 36, stomach 36 induces multiple activation of relevant brain regions, including the frontal lobe, temporal lobe, post-central and cingulate gyri, insula, hypothalamus, hippocampus, and other limbic systems, right? So these are all small studies. These are all small studies. However, this particular paper, what we are going to see, it's a complete meta-analysis of fMRI studies done on 400 plus in 401 patients in 16 studies. Okay, so this has encompassed all the studies done so far with fMRI outcomes, and it has just put on as one meta-analysis and systematic review. As we all know, systematic review and meta-analysis are on the top of the level of evidences, right? So this particular paper shows the top level evidence of what stomach 36, what needling on stomach 36 point does in our brain. Okay. So what it shows is primarily three areas. I just don't want to go like in depth about on what are the different areas and what analysis this, that, and everything. As you told, I'll keep the presentation as short as possible. Between 20 to 30 minutes, I will crisply finish this presentation. Okay. Now, three main areas get stimulated. So the first area is right inferior frontal gyrus. Let us just forget the right, left, and other things. So all these studies have used or done in right hand patients, like right hand predominantly using patients. Fine. So when they're doing it, what they found was stomach 36 stimulated right inferior frontal gyrus. Okay. And the Broadman area of cerebral cortex. I mean, there are like around 52 different areas, different Broadman areas in the brain. And this particular needling has stimulated Broadman area 2, 12, and 48. And which, like, going deeper into what this Broadman area 2, 12, and 18, 48 actually means is that Broadman area 2, motor control, it's associated with your inferior frontal gyrus, but this area 2 is associated with somatic sensation. Area 12 is predominantly for sight. It is the orbitofrontal area, which is predominantly for sight. And area 48, that is the one which processes our emotions. Okay, it processes our emotions, encoding and navigation. So all these things are done, get stimulated with stomach 36. That is area number 1. And the second one is left superior temporal gyrus. Now, this is really, really interesting, especially in stroke patients. Okay. Now, the IFG is inferior frontal gyrus and STG is superior temporal gyrus. Both these regions are involved in classic Wernicke, Lichtenheim, and Geschwind language processing model. Wernicke's area, we all know about this Wernicke's area. Okay, so if you don't know what exactly Wernicke's area is, this flowchart will help you in understanding that. Okay, fine. If someone tells, right? So I'm giving a practical example. If someone tells a tiger is coming, run from this place. Okay, so if someone is telling tiger is coming, run from this place, or a snake is coming, run from this place, immediately what happens is your brain should visualize, right? Your brain should have an image of the word which is being told. If you don't know what tiger is, If you don't know what tiger is or what snake is, you are not going to run from that place, right? So that comprehension of what is being told to you happens at the vernix area. So that is what this pink box over here shows. There's a spoken word, and this vernix area contains sound images of words. Okay, that is like kind of a box which contains sound images of words, whatever you say. Either it be the tiger, snake, mom, dad, whatever it is. It will have all the meaning for all that. You hear that word and then comprehend that word. So comprehension is the first key thing, right? And the second thing is about speaking. Right? You want to speak something. You are hearing a word and you want to say a word like, is it really snake? Is it really tiger? If you want to say that, what happens is cognition. Now you understood the tiger is coming. Vernix area found like what tiger is. So that would communicate to the Broca's speech area. Okay, so Broca's speech area, it communicates to the Broca's speech area. From that speech area, the signal goes to your facial muscles and your cranial nerves for you to speak a word, right? So to comprehend, you are telling a person to repeat a word means first the vernix area should comprehend that, and from there the signal goes to the Broca's area, and then that word comes out. That's how we speak. And understanding or reading a written word, so that involves area 17, 18, 19, and area 39, and then the vernix area which comprehends what is being written. Vernix area, it's not just the auditory thing it is analyzing, it just also analyzes the written word, and then only will be able to read the word tiger, lion, snake, or whatever is being written in a notebook. Okay, that is the simplest way, like how we are comprehending the spoken word or the written word and how we are speaking back. Okay, and now this is about the Wernicke-Jesuin model of language. To put it in a slightly what to say, in a deeper way, fine. Imagine there is a little baby. Okay, so there is a little baby. We are going to teach that baby to tell a set of syllables like amma, cha cha, nana, whatever it is. Like let me take the word amma now. Okay, we are going to teach that baby to say the word amma, right? So we are telling the kid like amma cholo, right? So now the first thing what happens is the information about the sound is analyzed by the primary auditory cortex. So the first one here, the primary auditory cortex, it is the one which hears the sound. Put it simply, it hears the sound and transmit it to the vernix area. Now vernix area, what we already saw, vernix area is the one which analyzes and comprehends the meaning of that word. Okay, auditory cortex, all it does is it receives the input, and vernix area processes that information and understands that amma is the image of the person who is standing in front of us. Fine. Now this information from the vernix area is now transmitted to the Broca's area through this arcuate fasciculus. Okay, through arcuate fasciculus, the information goes from the vernix area to the Broca's area. Right? Now, Broca's area, as we already saw, that is the area which makes us speak. Broca's speech area, right? So what this Broca's area does is it has a plan. Fine, it has a plan of what set of muscles need to be activated, what set of nerves need to be activated if I want to say the word amma. Okay, now the Broca's area forms a motor plan to repeat the word. Fine, so it puts the plan and sends it to the motor cortex. What we see here in the red color over here, this is the motor cortex, the area number 5. Now this motor cortex implements the plan. The plan is put by the Broca's area. What this motor cortex does, it implements that area, and then we would be able to repeat that word. right? Now we are telling like we are reciting sutras, shlokas, and so many other things. So participant has said the okay. So sutras, shlokas, and other things. So we are all reciting that. How it is all done is through these processes. The first process is, let me just tell one more time. So we hear a sound which is being taken and analyzed by the primary auditory cortex. From the primary auditory cortex, it goes to the vernix area, which analyzes what that sound actually means as much as possible as a pictorial representation or at least the meaning of that. Then it goes to the Broca's area. In the Broca's area, there's a motor plan which is being set on what are the nerves, what are the muscles that need to be involved to repeat or recite that word. Fine. So that plan is being put by the Broca's area. From that, it goes to the motor cortex over here, and then we repeat the word amma, cha cha or nana, whatever it is. Okay. Understood. So this whole thing is facilitated by stomach 36. Interesting, right? The whole thing is done by with the help of, I mean, when we are kneeling stomach 36. And that is one thing what needling that point does. And what also does is the STG, the superior temporal gyrus, is also involved in processing the emotional meaning derived from facial expressions. Again, the baby example would be a classical example, right? A classic example. So when we are talking to a baby, how we are having a face, like whether we are having a smiling face or an angry face, triggers a set of response in the baby. How does the baby know that the person is angry, the person is trying to scare us and other things? It is all because of STG. Fine. And the last one, last important one, right? Um, so this particular study, the systematic review and meta-analysis, it has actually shown the most expressed or the what to say, the most commonly stimulated areas. It has mentioned as these three common areas. Apart from that, there are a few other things that's been done as well. So I will share that paper anyway today. So that would be the paper for day 15. So I'll be sharing that paper too in all the groups as such. Okay. Now coming to the median cingulate and paracingulate gyrus. Now this forms a major part of the limbic system, right? So its important role is emotion processing and behavior regulation. Now, emotion processing, again, it's one of the important thing as far as stroke patient is concerned, right? So emotion processing and behavior regulation is done by the median cingulate cortex, which is controlled by stomach 36. And it makes a short-term memory as a permanent and long-term memory, median cingulate gyrus, and emotional responses to pain. Now, this very important thing is brain areas associated with somatic nociception is inhibited after acupuncture at stomach 36. We have already seen, stomach 36 has got analgesic property as well. Why? Because it stimulates the median cingulate gyrate, which is associated with the somatic nociception or the what to say, the pain perception that gets inhibited with stomach 36 stimulation. And interestingly, the analgesic effect is time dependent. Time dependent in the sense like how long you're needling, that is directly proportional to the pain, to the analgesic effect. Okay. And talking about the like, how long generally in out of these 16 studies, the common duration of acupuncture needling is between 5 to maximum 40 minutes. So they did not retain the needle for 1 hour, 2 hour, anything of that sort. It depends. I mean, the duration is just between 5 minutes to 40 minutes. So the longer we are retaining the needle, the longer would be the analgesic effect and the stronger the analgesic effect would be. Fine. So now the most important part and the last slide is the clinical application. how and where are we going to use this, right? So the first one is in traditional Chinese medicine, stomach 36 is popularly used for analgesia, cognitive function, and to improve the cerebral circulation. Okay. And the paper also says traditionally this is what stomach 36 needling has been used for analgesia, cognitive function, and to improve cerebral circulation. But in modern times, we are using it for stomach ailments and gastric problems. But in traditional Chinese medicine, this is what they've been saying for so many years back. And apart from it, for memory and emotion related things, stomach 36 can be used. And anti-inflammatory property, a strong anti-inflammatory property has been shown with stomach 36 point. And by needling for inflammatory conditions, stomach 36 needling would be beneficial, and it improves both the motor and the sensory nervous system to activate them. And for language processing again, it combines or it connects the vernix area with the Broca's area so that we can comprehend, we can understand the meaning of what is being spoken, and then the patient will be able to tell back what is being told. Okay. The coordination between both is very, very important. Very, very important. And so naturally for a post-stroke aphasia, this point would be an additional or added advantage. Okay. Thank you. Thank you so much.